Well, hello everyone. It's Dr. Gina Joe, or Dr. Gina Jefferson, Professor of Otolaryngology, Head and Neck Surgery. Attention, all of you fourth-year medical students. I know that you are all on pins and needles with the knowledge that residency interview invites are just around the corner. Well, I can say that faculty, just like you, are somewhat disappointed that this year's interview cycle is once again occurring virtually. Safety first. I do have some tips for you, however, to make it a successful virtual interview process. Tip number 1, practice. I recently saw someone else's post that gave tips for residency, application, interviews, and their tip was practice. But to be more specific, I would advise practicing the virtual format. Send a Zoom link to your trusted resident or fellow, mentor, and indeed practice the virtual interview. There are numerous residents and fellows who, just like me, want to give back and help the next generation of future otolaryngologists. More importantly, these people, that is, residents and fellows, are so much closer to having completed the interview process themselves that they can give seemingly real-time advice for you. So your Zoom practice should also focus on whether or not you're in a location with stable internet connection, making sure your lighting for the environment is adequate, and to really ensure that there's no outside noise that can distract from the interview process, like a railroad, for example. Tip number 2, you want to ensure that your Zoom interview space is not cluttered. Some may even advise that there are no personal effects in view. Well, I personally recall last year that there were a couple of candidates that actually had art they had made in the background. The art actually served as conversational pieces for both applicants. Art often tells a personal story and actually helps illuminate the character of the individual. So a signature personal piece in the background may be advantageous to you. This, of course, is actually up to you in the end. Tip number 3. While I recognize that much of the advice you will receive is to practice those questions you can anticipate in an interview, questions you have often obtained from your ENT interest group, from fourth-year medical students that are now interns in otolaryngology, these questions are widely available. What you do not want to do is memorize answers to these questions that you give verbatim during your interview. You want to come across naturally, so you should have an idea of how you will respond to those questions, but not something that is memorized and rehearsed. Remember, it is okay to laugh and actually to enjoy the process. If you find my tips helpful, share them with your friends and continue to follow me at Dr. Gina Joe on Instagram, YouTube, and Twitter.